Hey everyone, welcome to Writtennotes YouTube channel. In this video, we are going to see about medial pterygoid, which is a muscle of mastication, and this is one of the muscle in the muscle of mastication. We have already seen about the temporalis muscle. Now we will see the medial pterygoid. It is a quadrilateral muscle. It has a superficial and deep fibers. This medial pterygoid has two fibers, which are superficial and deep fibers. The origin, the superficial fiber, it arises from the tuberosity of the maxilla. This superficial fibers arises from the maxillary tuberosity, and the deep fibers from the inner and medial surface of the lateral pterygoid plate. There are two pterygoid plates, lateral as well as medial pterygoid plate, from the inner as well as medial surface of the lateral pterygoid plate. Insertion on rough area in the inner surface at the angle of the mandible below the mandibular foramen and posterior to the mylohyoid line. The insertion is on the rough area of the inner surface of the angle of the mandible below the mandibular foramen posterior to the mylohyoid line. This is the mandible. If there is a mylohyoid line in that, as well as in the mandibular foramen in the upper of the inner side of the mandible, it attaches to the inner surface of angle of the mandible. This is the angle of the mandible, like this. It is the angle of the mandible. This is the mylohyoid line, and this is the mandibular foramen. It attaches here. That is the insertion of the medial pterygoid. Nerve from the main branch of the motor root of the mandibular nerve passes through the OT ganglia. The mandibular nerve supplies here, which is the branch of the trigeminal nerve. Action: anti-gravity muscle elevates the mandible mouth by closing, and it joins with the lateral pterygoid to protrude the mandible, and it is used in chewing movements. For chewing movement as well as to protrude the mandible, this muscle's medial pterygoid joins with the lateral pterygoid, and it is an anti-gravity muscle. Now the relation are the superficial. Superficial is muscle, lateral pterygoid. The superficial relation where the muscle, bone, nerve as well as artery. The muscle relation is lateral pterygoid, temporalis and masseter. These are the muscles which are present superficial to the medial pterygoid. Bone is ramus of the mandible. Nerve is inferior alveolar nerve, because in the mandibular foramen, the insertion area is mandibular foramen. So inferior alveolar nerve travels to the mandibular foramen, as well as lingual nerve, because tongue is inside the inner part of the mandible. Artery, middle meningeal artery. Medial relation are superior constrictor of pharynx, tensor veli palatini, styloglossus as well as stylopharyngeus. These are the medial relation of the medial pterygoid. Thank you. For more videos, please do like, share and subscribe my YouTube channel. Please do comment it for motivating me for uploading more videos. As well as if you have any doubt in it, please do comment it. Thank you.